Network Entertainment.
Hi, I'm JB.
And I'm Ella. At
ito ang Kwentong Callroom, powered by the Pod Network.
Hey!
Hi, Besh.
Oh.
Yung shirt mo, very
Ano? What?
States.
Ay, alam mo ba?
Ay, ano ba?
Binili ko lang to kasi
Ay, okay.
parang may...
Akala ko may attachment ka sa Oklahoma.
Hindi, may party kasi yung pinuntahan na kailangan
Tapos?
sports-themed.
Basta parang merong ganyang fonts, may number.
Oo, basta mo ang jersey.
May jersey, okay
Ganun
na.
lang, ganun lang yung attachment ko doon.
Okay.
Eh, kasi, karamihan nung time na yon, karamihan lang ng damit ko ay scrubs, ganyan. Pero grabe no, ibang-iba yung mundo natin sometimes. Feeling natin, healthcare lang yung world. But such a large world, di ba?
Totoo, actually, no? Parang pag lumabas ka, tapos pag nakausap mo yung mong friends,
Refreshing, actually. Very
Diba?
refreshing.
non-med friends, to be specific.
Ay, oo naman, oo. Pero, I guess iba yung, kasi we've had guests here who were sons, daughters of doctors also. O kaya naman, parang sila yung parents, tapos
Oo.
yung anak nila.
So yung perspective mostly from MDs.
Yes. The MD side, whether sila yung parent or sila yung anak. But, got me thinking, what's it like if you're the only person not in healthcare?
If you're the non-showbiz, in a family of showbiz.
Yeah, the non-showbiz in a showbiz family.
Oo.
Ganyan. And kaya tayo may book right
Oo
here.
nga, kaya tayo may mug. Ano?
Yeah.
Labo.
kasi I actually met someone who is in that exact spot. And she
Family,
wrote the
yung
book.
family niya, doctors lahat.
Healthcare.
Healthcare,
Yeah.
okay.
And
Pero lahat, like kapatid, parents, healthcare.
we'll find out.
Oh, wow. May
pero-
teaser.
she grew up in that environment, diba? And I guess since we're doctors, medyo skewed na yung understanding natin. And we might not see the world as broadly sometimes. So, it's nice to talk to people who are seeing it from the other side, diba?
Totoo,
Parang,
no?
oo.
May iba naman yung perspective.
And promise talaga, Besh, it's all here. In her book, it's really good. I'll let her talk more about
Yes.
it. But it really gave me a lot of insight into medicine, illness, pain. And it's not even, you would think these things you could learn from a doctor. But sometimes it's great to find out from how other people perceive our profession. Diba? Oh. So, before that, sorry.
But
sorry.
before that, we are Kwento Callroom Podcast.
We're best friends and doctors, and our goal is to demystify and humanize medicine. So, we've been here since 2022, yapping, talking about medicine, talking about life, bringing guests in, talking to each other. So, if you've been there ever since, thank you so much, and we welcome you to keep joining the conversation, inviting new listeners, sharing the story, and just helping us keep the conversation going.
At feeling ko, kinlik mo tong episode na to kasi
Kasi
nakaka-relate ka na yung buong family mo ay nasa healthcare. Tapos ikaw yung pumili ng ibang path.
Pero alam mo, Besh, meron tayong listeners who aren't even in the healthcare field at all. They just want to listen, nakikichika lang. And yun naman yung goal din natin sa pod, that we just show that basically being a doctor is a job, and we can have the same experience, we can have the same frustrations, we can have the same jokes even some jokes are common.
Bilang tao din naman tayong lahat.
Yes, I love it. Ayan. So,
Tawagin na natin siya.
Okay, umalis ka dyan.
Gagalaw na ako.
Let's welcome her, the author of this wonderful book, Jen Soriano. Hi, Jen.
Hello.
I'm sorry, my cover of the book is very tattered and has been through a lot. So, this is Jen Soriano. Please introduce yourself.
Hello. Ako si Jen Soriano. And I did write this book. And I'm from the States. I grew up in Chicago, but both my mother and my father, whom you'll hear more about, were some of the only ones from their family to migrate from the Philippines to the US. And so actually, a lot of my family, extended family on both sides, is here. And so I grew up coming back and forth a lot, and just moved my immediate family, my husband and my son, to Manila last year.
So we're really lucky that this is a perfect time to get to talk to you on the pod. I actually just met her last year also when we were at an event for Dr. Writers. Yeah. So it was really nice to connect, to talk about stuff, and to read your book. I really loved your book. But before we get more into that, we have a surprise segment. So yeah.
Surprise segment.
Yeah, so we have this thing called rapid rounds. So rounds is what we do when we see our patients, but here it's a fast talk. So there are a series of questions. They are quick answers. You don't have to think. Yeah, you don't have to explain anything at all. But whatever comes first or whatever choice you have, if you're given choices, just answer straight.
If you're given choice.
If
That's
given
correct. That's
choices.
correct. Yeah.
Okay.
Okay, just so like whatever comes to mind
Yes.
off the top of my head.
Yes.
Okay.
You'll see the general feel of the questions. Okay.
Okay.
Are you ready?
Game na.
Okay. Go. US or Philippines?
Philippines.
Sunrise or sunset?
Sunset.
Beach o bundok?
Beach.
Oh, mahal mo o mahal ka?
Oh gosh. I don't know
Big
if I understand the
question.
difference. You have to
To
explain.
love or be loved?
Oh my goodness. Wow. How do I pick that? To love.
Social media of choice?
Instagram.
Platform. Okay. Singing or dancing?
Singing.
Sinigang or tinola?
Tinola.
What would you be in another life?
Oh, a beach dog.
Oh, I love it.
Yeah.
That's the first
Very
time.
specific.
Beach
A
dog.
beach dog.
Yeah.
First time I've heard that on the
I
pod.
can just lie on the beach all day
My new dream.
and be fed.
What would you be doing this weekend?
Probably watching my son's football games.
Oh, the dream. The dream.
True love or thriving career?
True love.
Aw. Beverage of choice?
Anything with lychee in it.
Wow, I love lychee.
Yeah.
Favorite Filipino word?
Pagmamahal.
Aww. Favorite Filipino snack?
Oh,
Or dish, if that's
I'm gonna
easier.
say it's hard. I'm gonna say bagnet chicharon.
Whoa!
Sarap.
I love it. Salivating as we speak. Most recent book you've read?
Oh, Human Acts by Han.
Oh, love it.
Have you seen that? Have you read
I
that?
have not read. It's on my TBR.
Incredible.
Yeah. Your favorite essay in your book?
Oh, that's hard. That's like choosing your favorite child. Yikes. Okay, I will say that's so hard. Okay, I'm okay. First thing that comes to mind is rupture.
Oh, I love that. Yeah.
I don't know if it's true, but
We can reflect on that later.
Yeah.
Okay. Your book in 3 words.
love letter interdependence. Love letter to interdependence.
Aww. Last question. 1 word advice to doctors.
One word?
Yeah.
Isa lang.
One word.
Yeah.
Wow, that's hard.
Say 1 sentence. na
Okay,
lang.
okay, I'll do one word.
Okay.
Listen.
That's true. That's true.
I
We
love
have to listen.
it. That will be our
was
jump off
fun.
point. Yeah. We do that to kind of
Break the ice.
Yeah.
And it kind of is a sneak peek into our conversation. Yeah.
That's great. I always hear those on radio shows, and they're my favorite parts of radio
Oh,
shows.
now you get to do
Yeah.
it.
Yeah,
You got
I
to
just
do
got
it.
to do it.
It's really fun, actually. And, it's an introduction, but it also tells a lot about someone. And it makes you think, like, oh, yeah, what do I want? Or what do I prefer? Yeah. So, I do them to myself. So,
You just quiz yourself.
so let's get to the topic. Thank you again for coming to the pod.
So fun to be here. Yeah. I got to watch some of your podcasts before I came, and it was really fun. You have such good energy.
Thank you. And the shocker.
I mean, yeah.
So, tell us a bit more about your background for our listeners. Like, what's the kind of family you grew up in? Your parents, brothers, siblings.
So, the whole reason that my that my parents went to the States is because, well, my dad at least, is because he's a doctor.
Okay.
So so the reason that I grew up in the States is because, I'm the daughter of a medical family. So, so my dad studied at UP. He studied medicine at UP, and he was originally actually going to start a clinic here in the Philippines.
Okay.
But the way that he tells it is that he kind of got like caught up in peer pressure because a lot of his friends were taking the exam to go
Abroad.
Especially during that time, I
Yeah,
suppose a lot
yeah.
of doctors go to the States.
Yeah, that was the norm back then.
Yeah. If you stay, that you're the exception.
Right.
Yeah,
he didn't want to
yeah.
be left behind. And he was like, oh, I see everybody getting, good scores on these exams. And like, it seemed like a prize that he also wanted to try to get.
Yeah.
So he's like, I'm going to take the exam too. And he did. And so, so once he got the prize of being accepted to go over, it was hard to say no.
Oh, okay.
So he went over, and then he actually met my mother over there.
Oh, okay. They did not know each other here.
Before?
Oh, even though she also went to UP.
Different batch.
Different batch, I think 1 year younger.
It's odd that you don't. Okay.
But it's
Interesting.
surprising, right?
Yeah, it's
But
surprising.
she's not a doctor, right?
She is an industrial pharmacist.
Yeah.
Oh,
So
okay.
she didn't study medicine.
Yeah.
Oh, okay, okay,
yeah,
okay.
yeah.
Yeah. So, but yeah, it is ironic because they were both born, in the same place. They were born in Tondo, they had family in Bulacan, they went to UP.
Oh, really?
And then they met each other in Canada. Go
Not in the
figure.
US.
Not
life's
even
funny.
in the US. I know, life's funny. So, and then my mom was supposed to come back to the Philippines actually because she was supposedly engaged to someone, but according to her, she wasn't. According to her mother, she was, right? And then she met my dad, and then she didn't go back, and then the rest is history. So
Stuff of telenovelas.
it is. It was kind of telenovela-esque, because my uncle didn't even like who she was engaged to. So he was all happy when he found out that my mom met someone else and was staying in the States. So I was born in the Chicago area.
Okay.
Both of my brothers were born in the New York area, and yeah, my whole kind of life experience growing up with my dad was really dominated by him being a doctor, because
What was your dad's specialization? Or
he was a neurosurgeon.
oh,
He was a
okay.
neurosurgeon, and I think there is something really particular about being newly migrated Filipino doctor to the States, where on top of neurosurgery already not being like the easiest
Definitely.
schedule ever, because he was new to the States. He had to work like extra even hard.
imagine.
Had to earn his keep.
He
Yeah.
had to earn his keep. He had to kind of prove himself. There were sort of, the way he described it, these like cabals of white doctors, that wouldn't let him in.
Oh, yeah.
And so he worked at 5 hospitals.
Wow.
Wow.
Yeah,
As a neurosurgeon.
as a neurosurgeon, all over the Chicago area, and he was just working like all the time. Yeah, all the time.
And the surgeries tend to run long. And imagine having that for 5 hospitals. Must have been crazy. Did you get to see your dad a lot? Or
My biggest memories of my dad were talking to him on the phone. Because he would call from the
voice,
hospital,
yeah.
like, "Hi, Dad," and then he would come home for dinner once in a while, but then he'd often go back to work after dinner, and then he would leave in the morning before I would see him. Wow! So very little. I saw him very little actually, but he kind of had this like superhuman presence in the house because from a very young age, I could tell he did something really cool. Like even before I knew exactly what he did and understood what neurosurgery was, we would just get all these presents at home, right? Like he would just get sent all these presents, and like really nice presents, like bottles of champagne,
Wow.
you know, like steak and lobster
Wow.
in dry ice, you know, and like my brothers and I would take the dry ice out and like freeze all the things, freeze anything we could find in it.
You also
know?
like get to brag to your classmates that my dad is a neurosurgeon. Do you have that?
Yeah, no, I totally had that too. And then I would brag to my friends about how like he would do surgeries at home on us. And they're like, on your brains? And we're like, no, not on our brains. But he did. And I wrote about this in the book about how he used to do little procedures on us, you know, like, he did like oral surgery on me once where he just like took a cauterizing pen and he like burned through my gums because one of my teeth wouldn't come out.
Yeah,
my baby teeth wouldn't come out
Oh.
because it was stuck to the gum. And so he's just like, here's some alcohol, here's
No
a
anesthesia.
cauterizing pen. And then he used this thing called Anbesol, which is just like over the counter, I don't even know what, like numbing gel.
Yeah.
And then the cauterizing pen, and then the tooth fell out into the sink, and I was like, cool.
That's awesome.
I was like, wow, my dad just did like oral surgery on me.
As a neurosurgeon.
As a neurosurgeon.
But really, doctors do have that kind of aura. Like even when I was young, every time I met a doctor, I had no idea what they did, but I just knew they were cool. Like, oh, that's a cool job. They're cool people in white coats. That was my impression. I realize now, even if we're doctors, I realized that when I was little, I had very little knowledge of what they actually did, like what hours you had to put in, or what kind of training you go through, or I didn't even know all the gory stuff with blood and all. I had no idea, and I realized I don't want to do surgery. So I do get how it's also big person and just coming in and doing cool stuff.
Yeah.
It has that feeling, right? Did your mom practice pharmacy?
She didn't. She never got her license in the
Okay.
U.S. So she was actually then really part of my dad's business. So then once my dad was able to start a private practice, then she was the one that ran the whole practice. You know, she did the business of the practice. She did like the patient management and stuff like that.
Did your brothers go into healthcare? Or?
Yes,
Okay.
they both did. So my dad's plan was that all three of us were going to go into healthcare, right?
Okay, a common
but 2 out of
thing.
3 is not bad.
Yeah.
Not a bad record. And I mean, you know, I did do something adjacent.
Okay.
So my brothers are both doctors. My older brother started out as a pediatrician, but then got pretty frustrated with the U.S. healthcare system and the fact that he only had about like exactly 15 minutes to spend with each patient.
They get timed for that.
Yeah, you get time for that. He had to, fulfill quotas, I believe. And so he actually pivoted a bit, and he became a pediatric cardiologist who specializes in imaging.
Oh, okay.
So he does the imaging part. And then my middle brother is surgical onc. So
Another whole battlefield.
a whole another area. And I'm so proud of both of them. And I feel like, even though I didn't become a doctor because I just was not for me. Like, I feel like I'm really glad that I'm really glad that I, didn't do that great in some of my science classes in college. Because it became really clear. I was like, this isn't for me.
But was there like a pressure from your dad, or was it just like mentioning you should become a doctor, or was there intense pressure?
My mom and dad were not big pressurers.
Okay.
They were very strict in other ways, mostly around like, you're a girl, you don't get to do all the things that the boys get to do, like that. But when it comes to academics and career choice, they actually were not that strict. They really gave me a lot of latitude. But that's not to say that they weren't like a broken record around constantly repeating options. All the options being different types of
Pre-med.
medical professions, Okay.
You could feel a
be
preference.
a dermatologist. You could be an ophthalmologist. You could be a
So a specialty.
Yeah.
Basically a doctor.
Here are
Basically.
your job options.
Yeah, look at all the options, all these specialties to be a doctor. Yeah. So they really, they definitely tried to steer me in that direction. And like, for whatever reason, my dad at one point, once once he saw that I really probably wasn't going to be a doctor, he kind of went a little bit on a campaign around dermatology is for you.
Oh my God.
I don't know why.
Zeroed in on that.
Yeah, he zeroed in on that. That was his last ditch effort. But really, once I personally started to get exposed to other options and told them that I was going to drop pre-med, they were okay with it, And I mean, they kept on bringing it up, years later, you can still go back to medical school.
Not giving up.
They're
Battle's not
giving
over.
up. Battle's not over. They're like, you can marry a doctor.
Just be connected with a doctor in some way.
Yeah, some way,
They
which
are
I did
persistent.
not do. They were persistent, but they were also very generous with, accepting what I chose to do, even though sometimes they didn't understand what I was doing. They're like, how do you describe what you do again?
I like how the options kind of just evolved into marrying a doctor.
Hopefully not be a patient because you're connected to a
Oh
doctor.
yeah.
Right.
Yeah. So you took a pre-med initially, right?
I was pre-med.
Yeah.
Oh, okay.
Yeah.
I was
How
initially
long?
pre-med. I lasted through sophomore year.
Oh.
Yeah.
What was your pre-med?
Where was it?
Oh, what was your pre-med? What was the course?
What
I think it was
the
just.
Oh, it was just pre-med.
Yeah.
It was just pre-med.
I think there were
Oh.
tracks
just
before.
requirements. Yeah, it was just kind of like
Oh.
full starting to, knowing what the pre-med requirements were and
Yeah.
just starting to take them. I did a major in college that a lot of pre-meds did
Okay.
because the major already had a lot of pre-med requirements in
Okay,
it.
okay.
So it was called history and science. And so a lot of the science requirements were already pre-med requirements.
Okay.
That's so interesting because in your book you talk a lot about history too.
Yeah.
So I don't know. It's just very poetic for me. It just all ties together.
I'm a fan of books about the history of medicine. I like reading the what do you call that? The four
humor.
the
floor humor.
humors.
Yeah.
Galen,
Right.
Vesalius,
Right, like what they used to
Yeah,
think back in the
yeah,
day.
yeah. Oh, you
the
love her
animists
book.
and the spiritists and
Yeah.
yeah.
People like Paracels. Wow.
Yes.
Yeah. Her book even includes some Philippine history. So that's really interesting. Yeah. So when you pivoted, that was in your second year. And what degree did you decide to do after?
So then I just stayed with history and science,
Okay,
but
okay.
I dropped all the pre-med requirements.
okay,
So
okay,
then
okay.
I actually did more history classes and then really focused more on the history of the 20th century development of the American medical system. And then also you had to focus on science. So some people were doing the history of physics. Some people were doing the history of chemistry, and I focused on biology.
Still medical adjacent.
Very medical
Yeah,
adjacent.
and I don't think that gets talked about a lot among doctors. Like, I doubt that someone could just stand up and just narrate the whole history of medicine without really checking their notes.
Since you mentioned about the history of biology, the one of the recent books that I read is The Song of the Cell.
Oh yeah,
Yeah, it was a great
I've heard
book.
that.
Yeah,
Oh,
about
so you would
history.
recommend it?
Yeah, so
Oh,
much.
okay. I have to add that to my list.
I love these intersections of social sciences and medicine. Because when you're a doctor, you tend to think that you're just going to study medicine. But I think it broadens your understanding so much more when you include social sciences. I'm a big advocate of including that in pre-medical curriculums. So it's really cool that you got to do that. I feel like you know more about the history than we do. Yeah, so
Did you have any of that in your medical training?
we did, but it was like, a lecture or like maybe at most a course, like a whole semester of it, but not really. So,
Ano yun?
well, my boyfriend, he's in the internet
Oh,
program.
yeah,
They have a
yeah.
history of medicine
Oh, yeah,
subject.
okay.
Yeah. So there are some moves for it, but it's not standardized, not like something everyone should know or everyone should go through. So it's interesting. So tell us, what was it like being, as we said earlier, the only non-showbiz in a showbiz family?
That's showbiz. I mean, I like being surrounded by doctors.
Do you feel
know?
safe?
I do. I'm like, if I have any accidents, I don't even have to call
surgeons.
911.
I'm good.
I'm good. And like I said, I didn't really have a ton of pressure.
That's great.
And so that felt good. And I really feel like my brothers and I, like we each followed our paths, like they really love being doctors. They geek out on it. They do continuing education stuff all the time. My oldest brother is, he's going to kill me for saying this, but he's getting to the age where he's thinking about retiring, right? Because he's getting up there. But in his retirement, he's already thinking about, what are the other kind of things he can study that have to do with the medicine that he's specialized in. Yeah, lifelong learner. So they really love it. And I mean, I get to benefit a lot because, they're really generous with their knowledge. And
great.
one of my cousins here has stage 4 cancer, and my middle brother, who's the surgical oncologist, has been helping a lot with just like translating, things that her doctor has been telling her, and just helping her understand. So being like another voice, for lay people to help understand more what they're going through as patients. And they do that a lot for me and my friends and like other relatives who aren't doctors.
It's so great that your brothers like really found their calling in medicine, because a lot of sons, daughters of doctors, some of them get pushed into medicine, not really finding their mojo in medicine. So a lot of them get frustrated with it, and a lot of them leave the profession or grow to resent the profession. So I'm really happy that your brothers actually enjoy the field, and
They do.
I'm sure they're really great doctors too. And I also notice a lot that doctors just can't stay put with I know I mean
Are you speaking
yeah.
from experience?
Yeah, I know. Even those who are retired, I mean, I don't understand sometimes why really old doctors are still teaching, are still in the clinic.
Why don't they just really retire?
Why are you not stopping? But I realize now it's not really from a greediness, not necessarily. It's more from they're not used to not doing anything anymore. Yeah.
The need for constant stimulation.
Yeah.
Imagine my dad went from, early on in his career working at 5 different hospitals to then it finally went down to maybe like 2,
Okay.
but still was doing full neurosurgery schedules, at 2 hospitals. To then at 55, he had to retire because he had a quadruple bypass.
Okay.
And then he was doing nothing. And then he could not, and it was driving my mom crazy that he was at home doing nothing. And so instead of doing nothing, he got like 75 hobbies.
Wow.
Like he was like, can I start rollerblading? Like at 60, he wanted to start rollerblading.
After quadruple bypass?
Yeah. And, he had a whole nother music career after that. And,
Wow.
And so I think... Yeah, I think
it's his personality.
Yeah.
It's personality, but I also think, doctors probably get used to
And they can't
just
stay
a
put.
lot of like stimulation, right?
Yeah,
Yeah.
Hi, I'm Joelle. I talk for a living and I'm an overthinker. Life keeps going and the questions keep coming. But I hope you find comfort in the fact na hindi ka mag-isa. Ang dami nating overthinker, no? Sa ups and downs, twists and turns ng buhay, paano kung ituloy lang natin ang paghanap ng kasagutan? Ready? Tara! This is Joelle's podcast. Paano kung? Powered by the Pod Network.
Throughout the time that you were growing up with your dad, your mom, and your brothers, did you ever feel like they were having a different language or a different
In
conversation?
the dinner table.
Yeah,
Ganun.
yeah.
Absolutely. Yeah, no,
Oh.
100%. There'd be shop talk. Shop talk that I'm
Yeah,
like,
yeah.
oh, there they go again with their, talking. I used to think it was like, it's like talking like their handwriting, which is like, I can't read their handwriting, like the whole doctor stereotype
Yeah,
of like really
yeah.
messy handwriting. It's like, I have no idea what you just wrote on that prescription slip. And that's how I feel listening to you talk right
All
now.
the medical terms,
Yeah.
jargons.
All the medical terms, shortened words.
Because
like,
it feels sometimes that we've sort of created a different language, but using the same English words. But it sounds familiar, but when you're on the outside, you can't understand it, and the doctors who are speaking it don't realize that they're not
Making sense.
yeah. I was like, what? We use the same English words for different meanings. And it's so interesting, but it's also wild how the English language can be repackaged in different situations. Like, take the title of your book. Sorry, I keep going back to your book.
Thank you.
So, it's called nervous, as in it could be the nervous system, but it could also be a sense of a state of anxiety, a state of agitation. And we don't realize that as doctors, we've kind of associated nervous with just the nervous system, but it could stand for different things. Sorry. So I love words, and I love what you did by combining the two and just showing these little overlaps that we don't notice because we're busy with our own lives. It's really cool. Yeah.
Oh, thank you. Yeah, well, and that's why I say that my brothers are like translators, like, I mean, when they're only speaking amongst themselves, they're speaking their own language and they go off. But they're really good also at translating other doctors' language, because I think a lot of times for patients, it's like, okay, I understand all the words that you said individually, you as a doctor.
Yeah.
But put together, like, what does
Yes.
it really mean for me?
Yes,
It's the
yes.
meaning part of like, what does it mean for me? What are you, so, and I think my brothers, when it's not their patients, are really good at translating that. You'd have to ask their patients how they are when they're actually speaking directly
It takes
to
conscious
them.
effort on the side of the doctor to actually be aware if the patient is actually following.
Yeah, exactly. Yeah.
So, given that, how would you say your experience with your family affected your view of, I don't know, doctors, health in general, or illness in general?
That is a great question. I was saying before that, I got this impression that my dad did really cool work. He had always had these like thank you letters that were like, "Oh, you saved my, cousin, mother's, wife's, husband's life," and I was like, wow, that's amazing. So, I definitely had that view, like, yeah, doctors do obviously such important work, right? Life or death work in a lot of cases. But then when it comes to sort of actual like wellness and health, yeah, I mean, I don't think I got a great example of how you actually take care of your own health,
So ironic, right?
It's so ironic. And I wonder, I would love to hear from you all if that's still true of newer generations like yours, because for my dad, and, again, migration to the US had an impact for sure, but I don't think he worked less than, 100-hour weeks.
Oh my
Five hospitals.
For probably
Yeah.
like a good 20 plus years. And he would eat like his meals were like peanut M&Ms for like breakfast, lunch, and dinner. And I don't know if you all know White Castle. It's like a fast food joint in the U.S. that has a reputation for being really greasy. Like, it's mostly grease and then some bread, and that's like what he would eat. He would eat. They come in like by the dozen. These small little burgers by the dozen.
Oh, okay.
And he would just eat those, and peanut M&Ms, and then he almost had a heart attack at 55. So I think my example of health was really like a life or death example. Like, if whatever is going on with you isn't going to shorten your life, you're healthy. You're well, you're good. And if whatever is going on with you isn't going to shorten your life, then you just walk it off.
Yeah.
You get up and you walk it off.
You're asked to just suck it up. Like,
Yeah.
If you're not dying, you're fine. Like,
Right. Exactly.
Yeah.
That's really what it came down to. Is like, and my dad actually used to say that in so many words. He's like, "You're not dying. You're
And
fine."
especially for his field, where I guess his perspective is also skewed because he sees a lot of people with, I don't know, gunshot wounds,
Yeah.
trauma cases, a lot of brain tumors or brain bleeds. So I guess this is the problem for him. So if it's a stomach ache or a toothache,
If it's not the brain, it's
Exactly. He's like, you're not bleeding out. It's fine.
but these are important things, and I think a lot of patients feel that they're not heard. As you said, one word advice would be to listen, and I guess that also comes from a lot of patients feel that they're not being heard, they're not listened to. And to answer your question, I think, to be fair, we see a lot more recognition about the importance of physical health, mental health. Like in our university, med students now have what they call Wellness Week. So like they have these pockets of time outside of their classes where they get to do yoga or Pilates or and these are school sanctioned activities. Like more and more, it's getting recognized as important and vital, or at least just to set a good example of how to take care of yourself, because it's really true. I mean, and it's not something that we noticed even as we were med students. Like we also had the understanding that, okay, this is gonna be a tough career. We have to suck it up. We have to take in the hours, and we knew conceptually that, okay, this is going to be detrimental to my own health, but this is a choice I made. So okay. So it's great that there are movements now to
Yeah.
push
That's
back
good to
on that.
hear.
I think it's gradually
That's really
improving,
good
like
to
the
hear.
recognition that sleep is important
Yeah,
for
yeah,
doctors.
That's like
Yeah.
a really revolutionary notion. Like, are there studies that have proved this?
Yeah.
And we're like, yeah, people knew that way before though.
But I'm also like guilty of delaying seeking care because I know that I'm a doctor, so I can manage, and then some things get worse. And doctors can be the most stubborn patients.
Yes.
And doctors' parents are also the most stubborn patient. Yeah. But I'm interested, given that your dad really has a different view of what not okay is and what okay is. Did you feel like some ailments were minimized or like trivialized? Did you have that feeling growing up?
Yeah, very much so. Very much so. And, I mean, I think just along your theme of humanizing doctors, right? Doctors are human. My dad was a human being. And so I think he was, limited like we all are by his experience and what he's experienced. And so, like you were saying, a lot of his experience in a given week was trauma, like, really acute trauma cases or, brain tumors or, just very, very high stakes situations. But then you add to that the fact that, he personally was a pretty healthy guy beyond stress and how much he worked. He didn't really have, a lot of conditions to deal with himself until he had high blood pressure, until he had, heart disease issues. And so I don't think he had the experience that I had of, having a bunch of ailments. He was just generally able enough, right, to work that much. And so, there was minimization because in his book, based on his experience, what I was experiencing really wasn't that bad. Like if he was looking at it just from kind of the textbook version of like diagnosis, right? And then treatment based on the diagnosis. It's really like, no, not a big deal. But what he was unable to see was really the illness experience, right? Behind the diagnoses and what I was actually, experiencing through these diagnoses. So for example, he was actually the one that diagnosed me with mild dystonia.
Okay.
And, the mild part was really the key part, right? Because some people with dystonia, it's very serious and you have to have pretty serious treatment. But for me, it was mild enough that I could still function most of the time, right? But what he didn't know and what I didn't know how to express, and he didn't know how to ask about, right? Is that, that mild dystonia is something that actually affects my body systemically and leads to inflammation and leads to, like a lot of kind of mechanical dysfunction,
chronic pain
in
too.
my body, and dysfunction. It makes it hard for me to breathe. Sometimes makes me hard for me to swallow, and that all adds up to an invisible disability that has really affected my daily life. Even though I can still function pretty well, I don't function the same way that a fully able-bodied person does.
You mentioned you had a list of diagnoses. I forget how much, but you had a lot of diagnoses that were all labeled as mild or manageable. These are words that we doctors like because, we like to hear that. It means prognosis is good. The diagnosis
Gives us
is
like somewhat a false assurance or
but
temporary assurance that it's mild now.
I think that's where we get it. I mean, we tend to equate diagnosis and prognosis with experience. But it could be that, okay, it's just mild dystonia, but this is what that means for me. We don't ask that question because we're not
illness experience.
Yeah, we're not trained to ask it because we just have the history, physical exam, diagnosis, and then treatment. We're not we're not trained to ask for, okay, how is this affecting your daily life? Or we're also not in the context of, we're not big on wellness. We're not actively asking, how else can I improve your daily life? We're all just in the, okay, how do I fix this? This is broken. How do I fix this? We're not in the, okay, the light is dim, but it's a dim light, but at least it works. It allows me to read, but we don't actively try to make it brighter. We have that toxicity, I think. And again, it's because that's how we were taught and how your dad was taught.
Right. Yeah.
It's the context he grew up in. It's not because he's actively the villain here. No, it's just because he was not taught to think of those things.
Right.
Yeah.
Right. Exactly. Yeah. And I think that as a patient, it's not necessarily that I would want to kind of demand the impossible from doctors, right? I'm not asking doctors to like
heal me,
hold my hand in daily life, right? Like, come walk with me while I complain to you about how I feel. But I do think that some of the most helpful doctors that I've had have been doctors who have seen themselves as part of a larger ecosystem of wellness, right? Where they know that they can't solve all the problems and that they can't necessarily make me well or healthy or ease my suffering on a daily basis, but they might be able to refer me to some other complementary practices or even other types of doctors, specialists who could support,
being open to that. General measures. I think we also have this toxicity in thinking that the health or the illness is the main character here, when in fact it's just one little part of a broader narrative that the patient experiences. Like, we're not good at thinking of things that way because it's all we see day to day. Like for your dad, it was gunshot wounds and traumas and all. So he's used to that being the big picture and not like, okay, this is a mom or this is a sister or this is a student and can't go to school or go to work. So just a lot of differences in how we see the world. But going back to that, given that you grew up in this kind of environment in healthcare, did that also affect how you saw other doctors? Or like, do you compare them to your dad? Do you compare them to your brothers? Do you notice that you go to these comparisons when you see doctors?
I don't know if I would compare, but I did feel like, that I had a little bit more prep. With engaging with doctors than other people, so it's like, even if I didn't completely understand all the shop talk, I felt like I could come in and at least, have
familiar white noise.
How to approach.
A basic conversation. Basic conversation. I think it really helped me be my own better advocate, because I can argue with my dad and my brothers all day, So if I can do that, then I can go in and I can advocate for myself in front of any doctor, So I think that's been helpful. It's kind of like how you say you demystify things. Like, I do think that growing up in a healthcare family demystified the healthcare system for me. So I think it so I think I have a better idea of how to navigate it, and also, know that I can ask for second opinions or, look for second opinions. And my brothers actually have been really helpful with that as well, around, just affirming that.
It's funny. It's like you had this inside information. Doctors are humans. I live with them. They're at home.
Totally. I'm it's
they fall asleep.
Doctors are just like us. It's like the celebrities are just like us. Yeah.
Maybe a way to end our conversation. You mentioned having really good doctors who, compared to other doctors, tend to listen or speak to you in a broader sense and not just seeing you for the illness. Maybe for our listeners who are mostly trainees or medical students or doctors themselves, what were these things that you appreciated in the doctors that you talked to? Just so our listeners can also get something from it.
Well, I'm thinking of a really specific example, and I'll just say her name. Her name was Dr. Megan Wrights. She was an internist that I had, when I was in my early 30s, and she was someone who felt kind of like a partner in my healthcare. She wasn't just sort of telling me what to do. It wasn't just one way. So she listened for sure. And not only did she listen, she believed me when I said I needed something. So for example, when I said, hey, this particular medication I'm using for pain management it's not working for me right now. It used to, and it's not working for me anymore. So she listened to me, she believed me, and she is actually the first doctor who would actually prescribe me opioids. I couldn't get opioids before.
And so difficult to do that in the States.
It can be very difficult, and for good reason. For good reason. But, there's statistically, women are undertreated for pain. And it was actually really useful for me to actually try the opioids because it really did work for my pain. But it had the side effects for me were so severe that I couldn't stay on them. So I then told her that, and she listened to me again. And then we kept on, she kept on doing a lot of trial and error experimentation with me, and she stuck with me on it. You know what I mean? She didn't just kind of put the hatchet down and say,
I'm
that's
right,
it, right? I'm right. And then eventually, right, she added her own expertise to it too, and she said, this medication-based management is not working for you. So let's try some different tactics. And so that's when she sent me to a specialist who was the one who actually diagnosed me with central sensitivity syndrome. And then once I got that diagnosis, that actually opened the door to all kinds of other complementary therapies, to deal with fibromyalgia and systemic inflammation. And she helped me navigate those as well. So, she became sort of this sort of, she was like central command without being commanding. She was like central coordinator. And and it was really helpful. It was a really big turning point in my health journey.
That in the whole story, it wasn't that she did the right thing, but I'm sure she did a lot of right things, but she didn't know the answers right away either.
Right.
But she was willing to sit with you and talk to you about it and help you go through what you were going through. And that makes a world of a difference. And one doctor I heard on a podcast, I'm sorry, I forgot your name, but one really good advice said was one way he talks to patients is that you have more votes in this than I do. Like, you're the one with the body, you're the one with the illness. So I'm here with the knowledge, but you have more stakes in this. You have more votes in this. So I can guide you through it, but I want you to also know that you're in command of this. And I think that's so important for patients to realize and understand that it's not something that you just hand over to the doctors. It's something you do together. And I think patients appreciate that when they feel that they're part of care. And
absolutely. It's like, yes, put us to work. If you will just yes, I think that's a really good way to put it.
Yeah. Well, thank you so much for
Thank you so much.
This was
Jen.
so helpful and very insightful. I'll give you time to promote your
Yes,
book.
definitely.
Oh, but you've already been such a great hype woman.
Yes, I do. I'm a hype girl. I could be a promo girl in another life. But where can they get your book? And
So it's available at fully booked branches, although I've heard that the Glorietta and Power Plant ones are sold out. But anywhere you go to fully booked, you can always ask them to restock it if they don't have it already. And it will soon also be available at some independent bookstores, including Good Intentions in Makati. And some other places as well.
no, just look for it. It's Nervous Essays on Heritage and Healing by
Is there
Jen
like
Soriano.
a Kindle version? No.
There's a Kindle
okay.
version available on Amazon, and also you can get the paperback from Amazon as well.
Okay.
Yay, thank you so much.
Thank
I
you
love.
so much, Jen.
I would love to talk more, but we have limited attention span and time. So
This was fun.
yeah,
Thank you
it
for having
was.
me.
Thank you so much for coming on the pod and talking to us. So, to our listeners, if you enjoyed this episode, please follow Kwentong Callroom Podcast on Spotify and YouTube. We drop new episodes every Monday, 5 p.m.
You can also follow us on social media for more chika and updates. We're Kwentong Callroom Podcast on Facebook and YouTube, at Callroom Podcast on Instagram, Threads, X, and TikTok.
You can also join our Discord community, Callroom Tambayan, our official community server where you can join us at iba pang mga ka-callroom.
So each week, meron din tayong episode that we release every Monday, 5 p.m.
And if you have questions, concerns, and chief complaints, open pa rin ang kwento mo sa Callroom. It's a Google form where you can submit your questions to us. Kung mapili yung kwento mo, pwede namin yan sagutin in one of our future episodes here on Kwentong Callroom Podcast. To submit, just find the link in our social media pages.
And if you want to reach us via email, you can reach us at kwentongcallroom@gmail.com.
Jen, please join us for the outro.
Yes.
With that, I'm Ella.
And I'm JB.
And I'm Jen.
And this has been Kwentong Callroom.
The opinions of podcast creators, hosts, and guests are not necessarily reflective of the official stance of the Pod Network Entertainment, its hosts, or other network programs. The content created by the people behind the podcast is personal and not meant to harm any religion, ethnicity, group, organization, company, or individual.